Okay.
All
Okay.
right. And are we recording?
We are now.
Okay, thank you.
Okay, hitting enter.
Hello, everyone. Welcome. If you are not muted, we will probably mute you or mute yourselves if you would. We're expecting a pretty big crowd. This is Shelley Feist.
Shelley, you got muted.
So there I am talking to no one. Thank you. Thank you, Jen. Well, I'll start from the beginning. Thank you all. You're all muted. I'm really excited to have you here. I believe this is a topic, I know for my own purposes, I'm very curious about learning more about Cyclospora and what's going on. And we're very excited that Jen and Trevor were able to be with us today to answer your questions. This is really intended to focus on Q&A. We're going to do a few slides really to just overview of what is going on with the current outbreak. But the intention is that you all can get questions answered by experts who have probably been, I expect, looking at this issue of Cyclospora in produce. Jump off here and get to my slides, and then we will get started. Remember to enter into chat any questions you have. You can do that at any time so that we can get right to questions. And again, we're going to try to keep this to about 40 minutes total. Again, this is being sponsored by the Partnership for Food Safety Education. Our work is entirely in consumer education, in helping people understand what they can do to reduce their risk of foodborne illness. My name is Shelley Feist. Here's how to contact me. Our main website is at fightback.org. We are also the creators, along with the FMI Foundation, of the Safe Recipe Style Guide and the developers of the Story of Your Dinner campaign. Our speakers today are Dr. Jennifer McEntire. She's Vice President for Food Safety and Technology at the United Fresh Produce Association, and Dr. Trevor Suslow. He's Vice President of Food Safety for the Produce Marketing Association. We're proud that both United Fresh and PMA have been longtime participants in the U.S. Partnership for Food Safety Education. Again, please enter your questions into the chat function, and we are planning plenty of Q&A time. Your questions might be about surveillance or about Cyclospora in produce, about the current outbreak, or about symptoms, whatever questions you might have. We are very pleased that Dr. Ann Straley is with us too from the US CDC, and I'll find her in a moment. So we have a great group of experts to answer questions. We're going to launch a poll quickly to just sort of get a sense of how confident you are in your knowledge of Cyclospora and its impacts on human health. One, you're very confident, you're an expert in this. Two, you're somewhat confident, you're here to learn more. Or you're not at all confident and you're just beginning to learn about it. So Katie will launch our poll. I'm not, so take a moment to answer. I don't see the poll, but that's possibly because I'm in my slides. Oops.
Hey, Shelley, I don't think you're sharing your screen yet.
Oh, okay. Everything that I had set I have to set again, I see. Why does it do that to me? It says I am. You guys can see that, huh? Now do you see it?
Yes.
Are you seeing the screen
Yes,
now? Okay, okay. So now I'll go through. You can see Trevor and Jen now. You don't even need this. Again, put your questions in chat. I'm very sorry about that. Poll. Again, our poll question, Katie is going to launch about your level of confidence in your knowledge of Cyclospora and its impacts on human health. 1, you're very confident, you're an expert. 2, somewhat confident. And 3, not at all confident.
Shelley, we have the poll results. I don't think you can see them. So
right.
I'll read them for you. 9% are very confident, 46% are somewhat confident, and 45% are not at all confident.
Okay, great. So then what I love about that is that means you're all here to learn, and most of us feel we have something we do need to learn about Cyclospora. And I certainly count myself among those who do need to learn something about this. All right, back to our slides. All right. I'm going to turn it over to Jennifer McEntire. Dr. McEntire, thank you so much.
Hey, Shelley, thank you and the Partnership for Food Safety Education for having me and Trevor today. We'll quickly run through some of the basics on Cyclospora. I have to admit, I didn't put that I'm an expert. I feel like there's still a lot that needs to be learned, and that's kind of part of the challenge with this organism is we don't have the same level of knowledge and understanding of this pathogen as we do with many of the other foodborne pathogens. So the illness associated with Cyclospora cayetanensis is called cyclosporiasis. It is extremely unpleasant, but it doesn't kill people, but very unpleasant nevertheless. One of the challenges that we have as food safety experts is we really don't know how to kill it. We know for some of the other types of pathogens, the mechanisms that can kill it, heat, freezing, the various sanitizers that we use in facilities. But for Cyclospora, it seems to be quite different. It is a parasite. It's a totally different type of organism than your E. coli or Salmonella or Listeria or norovirus. It does need people to be to replicate, and humans, at least at this point in time, are the only known hosts for Cyclospora. It has a really weird, complex life cycle that we're still trying to better understand, but it appears that unlike other types of pathogens like norovirus or like pathogenic E. coli, it's not the straight fecal oral route. People who are ill not washing their hands, kind of touching food, and then you eat that food and get sick. It doesn't seem that that's what happens with Cyclospora. Even though it is associated with human feces, it seems to need some time outside of that human host before it can actually cause illness. So the maturation process, we think it's maybe a week or two, not really sure. Trevor, anything you would add as we move to the next slide?
Trevor, you're muted.
And the next slide.
I have to go split screens in order to see your slides. So,
Oh.
no, I think the only thing that I want to add just to help this group understand what we do know about it is that it is susceptible to inactivation with things like UV and ozone, and it can be removed by hyperfiltration. It's just that those are really more sort of water processing technologies that are used, hard to see how they can fit in readily into the fresh produce handling. So that is a problem. The normal systems we use for water treatment are certainly, we know that they're not effective.
Okay, I'll go to the next slide.
So I saw there was a question, I think, about number of cases, and it may appear if you look at this that the number of cases has increased dramatically over the past couple of years. And in a way that's true, but I think that it's probably more likely an artifact of having much better tools at the healthcare provider side to diagnose Cyclospora. So we are, again, pretty early in our understanding of this organism. We don't have rapid real-time tools to tell one cyclospora from another cyclospora. These are types of tools that we do have to distinguish outbreaks of other types of pathogens, some of the bacterial pathogens. So right now we're just kind of looking at all these cyclospora as one big mass, and it becomes more challenging to distinguish one outbreak from another. But clearly this is an organism of concern now that we have the tools on the diagnostic end to understand that people are getting sick from Cyclospora. We know that we need to, to work on it and to do something about it. So next slide, please. Here's one illustration from cases from 2 years ago. So we have this mass of cases. You can see the ones in the gray. Really don't know what type of food product caused them, or if it was one type, if there were several different food products associated with illness, really not sure. There were 2 outbreaks that could be kind of teased out of this mass, and those were based on epidemiology. So talking to people who were ill, who were known to have cyclosporiasis, and seeing that they were eating items in common. So in the blue, it was associated with a convenience store chain and a specific product out of that store. And in the yellow, again, a fast food chain and a very specific product that was consumed at that fast food chain. So it wasn't a scientific, being able to distinguish the nuances between the organism. It was really based on the consumers and their recollection of what they ate. But so many of them are unknown, at least at this point in time. So next slide, please. Trevor, you want to talk a little bit about the variety of organisms that have been associated with Cyclospora?
Well, yeah, I just wanted to kind of graphically illustrate. Again, it's not exclusive, but in general, those produce items that have historically been most associated, when you've been able to do a little bit better job, as Jennifer said, about looking and associating cases with either clusters or point of purchase, point of consumption. Berries certainly was the one that really brought it to the sort of food safety community attention, certainly in produce around berries. It's quite often associated with imported product, but as we're learning, as we'll probably talk about during Q&A, not exclusively. So things that come up a lot, berries, basil, cilantro, snap peas, snow peas, scallions or green onions, and then of course multiple outbreaks over the last couple of years associated predominantly with packaged salads, either romaine, iceberg, shredded carrots, things like that. Different ingredients, red cabbage, green cabbage, sometimes difficult to tease it out. So if we were live, I wish we were live and together, but that's okay. So I might be asking you, what do many of these have in common? And so one of the things that many of these commodities have in common is that there are a lot of human touch points. There's a lot of hand harvesting. There may be multiple people involved in hand harvesting, and not all of them, go through the same processes. So that sort of, issue around, Jennifer mentioned, not quite the same if somebody's ill, and, fecal oral, transfer it directly to the product. You're not going to have, at least the dogma, the paradigm is, you're not going to have direct, immediate illness. It has to mature. It has to sporulate. So exactly where this contamination is coming from is still a bit uncertain. That's good.
So I think the impetus behind this webinar today is that there is an outbreak that is occurring. The last count was 206 cases, 23 hospitalizations, no deaths. Again, death is not typically associated with this type of foodborne illness. And I would anticipate that these numbers will continue to increase because of some of the lags just in reporting. So don't be surprised, I guess, if that 206 number does go up. But oddly, it seems confined, at least the cases, the illnesses seem confined to this upper Midwest area. The illness onset date range seems to be early to mid-May through at least the 17th of June. And again, these are numbers that the outbreak's not over yet, or at least we don't have all the data in yet. So these numbers probably will change. Next slide, please. There has been a recall. So Fresh Express, the brand has recalled an awful lot of products, more than have been epidemiologically associated with the outbreak and in a broader geographic region than has been associated with the outbreak. So there are some store brands that are affected. You can see on the FDA website, which we'll pull up in just the link to that in just a moment, that you can find these specific products that have been recalled. Again, it's a pretty long list, and certainly you'll want to check your refrigerator, advise the individuals that you're talking to make sure that if they do have this product in their possession, that they do not consume it. Next slide, please. So I think this webinar is being recorded, right, Shelley? And so you'll send the links out to the people who registered, because I know you can't just click on your screen right now, but CDC has updated information, FDA has updated information so that you can learn more specific to this outbreak. Trevor, you want to add anything?
No, I just thought that, Matt, if you look at the image there in the red arrow, that's one of the pieces of information, talk about very specific lot coding that, if you get questions or if you are doing any kind of outreach program, specific, codes and looking for that Z and then numbers lower than 178. But also, if you're really, really paying attention, we said earlier it was, it mentioned, iceberg, red cabbage, and carrots. And here it says romaine. And this is really associated more with currently the products that are being recalled. There's quite a range of products covered in the different, products that came out of that processing plant operated by Fresh Express. So again, there's some confusion, but at least to me, I like it because that is something consumers specifically can look for, and it's helpful to identify that, and all of that information is in CDC and FDA notifications.
So again, Shelley, I anticipate that you will send the links out to people so that they can get the latest from the agencies, as well as understand the types of symptoms, which are, they're kind of general and similar to other types of foodborne illness. So I always encourage people that if they're not feeling well, seek medical attention. Go to your healthcare provider and try to get a diagnosis. It's very helpful, I think, to have more accurate counts to understand where these illnesses are occurring and when. Next slide, please. So I think one thing that I didn't mention is that another peculiarity of this organism, of this type of illness, is that it is quite seasonal. And so that chart that we had pulled up, it seems to be a late spring through the summer type of illness. We really don't see cases through into the fall, through the winter. So that's another thing that I would point out. So it is Cyclospora season, if you will. So again, if you're not feeling well, you have those types of GI symptoms, do seek medical attention is, I think, a key point. Trevor, anything you want to add before we go to questions?
No, I think this is a good time to just go right and try and answer the questions that are on the minds of our participants.
Yes, thank you both. And I think based on our poll, there's a lot of interest in this and a lot of questions. So I'm going to start with a question from Kimberly. Has there been any outbreaks related to produce grown using alternative growing methods, such as hydroponic or aeroponic?
I think we don't know. I think there are so many illnesses. The majority of illnesses are not, at this point in time, we're unable to figure out what's caused them. So I would be reluctant to make any definitive statement about what is or isn't causing illness.
Okay. There's a question about what can, and I'm going to ask if Dr. Straley is here, to unmute yourself if you'd like to chime in on this question. What conclusions can be drawn to the seasonality that seems to be associated with these Cyclospora outbreaks?
Hey, this is Ann Straley with CDC. Can you guys hear me?
Yes, very
Yes.
well. Thank you,
Yeah.
Dr. Straley.
Hi. Thanks for inviting me, I guess, to listen in and to answer questions like these. I do appreciate Dr. McEntire and Suslow's presentation on this. I think they covered it really pretty well. So with regards to the seasonality, there really isn't anything that we know that we can say for sure about why it is a seasonal disease. Cyclospora it's a different beast when it comes to foodborne pathogens, and it is an organism that defies sort of all the explanations that we've tried to pin on it so far. So long story short, we don't know why it's seasonal.
I have to say, this is the first time, I mean, it gets a little scary when our experts are like, you know, we just don't know yet. We don't know. This is a crazy little bug, sounds like. Okay, public health risk. Is this routinely tested for with individuals who have these typical symptoms, or does it have to be specifically requested? I guess testing for this. That might be another one, Dr. Straley, if you want.
I'm not a medical doctor, and so if somebody is a clinician on the line, they would probably be able to better answer that question. But the diagnostic tools do seem to be vastly improved, and there's an ability to kind of screen for many different organisms and to be able to get a pretty rapid result. And that's Cyclospora is one of those many organisms that's screened for. And so I think that's helped us immensely understand the burden of illness associated
Right,
with
and again, Dr. Straley can correct both of us if necessary, but my understanding from talking to a number of people is part of that is because the newest technologies that may not be universally used, but are more widely used, even if the physician doesn't order that test, it's part of the panel. And if you just have sort of the general symptoms, quite often my understanding is that is why it's increasing in reporting. It's picked up and identified as, part of or the illness for that patient. Might expand on that a bit if that might be helpful.
Yeah, sure. So this is Ann Straley with CDC again. Yeah, just to follow on what Jennifer and Trevor said. So the diagnostic toolkit has changed a little bit. So historically, Cyclospora was really only detectable on an ovum parasite exam of a person's stool. So you have to submit a stool specimen to your doctor. Somebody looks at it under the microscope essentially, but there are special techniques that need to be applied to that microscopic exam in order to better visualize the oocysts, and those are not routinely done. So the physician does have to specifically request that kind of testing. And so if the physician isn't thinking Cyclospora could be one of the, dozens or hundreds of different things that can cause a person to have diarrhea, then it might be missed on a routine O&P. Now, that being said, there are some new diagnostic tools, these multi-pathogen molecular testing panels. Cyclospora right now is included on only one of those, to the best of our knowledge. So if a physician were to order one of the panel tests for Cyclospora is not included, then again, it might be missed. So it's not the easiest thing to test for still.
Maybe I can ask a question. Do you have any sense for, how widely or how broadly that panel that, rather than get into names, that does include Cyclospora is being used? And, maybe just share, one of the changes without having to do all the microscopy and some of the other, PCR DNA related tests, that at least, the screening can be very, very fast as opposed to taking multiple days and being extremely difficult for, general practitioners. So it's a specialized skill to visualize them.
Mm-hmm. Yeah. So the test, the multi-pathogen molecular testing panel that includes Cyclospora was introduced on the market in 2014. So it's only been around for a few years. And we routinely started or systematically started collecting data on test method and test type really around 2018. So we have sort of 2 years worth of data, and we're collecting now a third. The FoodNet group at CDC, which is separate from the division where I work, they recently put out a publication about their pathogens, and Cyclospora was included in one of those. And they did have some information on the changes in diagnostic testing type over the years that were included in that summary. And for 2019, at least, or 2018, whatever the last year was, it was reported. It was interesting because the percentage of cyclosporiasis infections that were diagnosed via microscopy also increased. So the use of these molecular testing panels didn't necessarily account for all of the changes in testing, if that makes sense. So physician awareness might also be playing into this, which is great.
Thank you. Thank you all. That is excellent. Here's a simple question that is probably would be of interest to consumers. Teresa asks, can washing with diluted soap solution remove this pathogen?
Don't wash with soap. Don't.
Yeah. But maybe we can answer in a more generic way, is that,
Yes.
like with, all washing, there is a certain level, and of course, many of these have already been washed before it gets to either food service or retail and consumer. And, where it's been studied, either, directly or indirectly with some surrogates, some things that are not exactly, but very similar to this parasitic pathogen, the challenge always remains that you remove some, but not all. And a lot of it depends on the characteristics of the commodity. There was some really interesting work, initially done with raspberries and, very, high, not to insult the audience, but with, a very high level of microscopy, scanning electron microscopy. And, if you look at a raspberry or a blackberry, or even the surface of something like cilantro, I mean, relative to the size of these oocysts, it's, like, wedging something into, Grand Canyon. So it's very, very difficult. Once they're there, once they're attached physically or by other mechanisms, very, very hard to ensure that you can remove all of it.
All right, let's move to another question. Diane asks, have we met with Mexico at all? In Mexico, don't they say the rains have a correlation? Have we shared knowledge with Mexico, in short? Has Mexico done more, research? What do they find?
So you want to start with that one, Jennifer, and I can always tag team with you.
Okay, I'll start. So the short answer is yes. I think this is it's recognized at a global scale. So it's more than just Mexico, but Mexico, yes, many of the associations have been with product from Mexico. And so there is involvement there, including at the, many of our shared member companies have operations in the US, but also have operations in Mexico. And so they have a vested interest in ensuring that all of their produce is safe. So it does include working closely for some of them with the local hospitals, keeping an eye on the rate of illness just in the community, and making sure that everyone is connected. And I think that here, because we are kind of early in our understanding of this organism, it's critically important that we maintain that communication, that those few people who do understand the organism are working with each other cross borders, between government, industry, academia, that everybody is pooling their resources to try to tackle this.
Yeah. No, and I'll just add, and that's certainly true, not just Mexico, but, countries within Central America, South America, very aware of the issue. And again, as Jennifer said, very protective of their export business. There's a tremendous reliance on the products. And this is, again, sort of follows the history of Cyclospora and the evolving understanding of both the seasonality, some of the sources where it can be detected. One of the things that I think, in the near term will definitely improve sort of the community of science and research and public health addressing the problem is the development of a much more specific and much more readily implemented test that FDA developed. And we can see that is being incorporated into surveys, into community health assays, but, also the industry asking about the nature of the farms and their water sources and things like that. So not perfect, but definitely a better tool in the toolbox.
Thank you all. Okay, there's a question from Bradley. Are there other foods other than produce that are carriers of Cyclospora, or where we've seen Cyclospora outside of produce?
So again, the outbreaks, when a food item has been able to be associated with it, which is seldom, it usually is some fresh produce item, but as Trevor mentioned, there's a diversity in items. So we don't have evidence of other types of foods carrying Cyclospora, but I can tell you from side conversations that I have that other parts of the food and beverage industry are very curious and somewhat concerned, because there is so much that we don't know, and there's so many illnesses that as of right now we don't know what's causing them. So other parts of the food system are thinking about this organism and wondering if it does have relevance outside of produce.
This is Shelley. I'm just going to ask my own question, because Jen, you've referenced this a few times, that this is relatively new, or we're still learning about it. Can you give us a sense, and maybe Dr. Straley too, about how long have we kind of known or seen this pop up? Like, is it just a matter of a few years? I'm curious about that.
What was, Trevor, when was the raspberry, the cake incident? Relative to the history of other pathogens.
I'm putting it on the top tip of my tongue, but 96, 97-ish.
So, okay. You may think that like 20 plus years is a long time, but compared to other pathogens, it's not time-wise. And the other part of the challenge is that it's really, really difficult to work with. So this is not an organism that you can take into the laboratory, grow up, test tubes worth of organism and do experiments on it. We're very limited. I think the researchers are very limited in just the material to even work with, because it doesn't grow outside of a host. So there are many barriers that prevent us from kind of accelerating our understanding of this organism.
Excellent. Thank you. Dr. Straley, would you add anything to that?
And I guess the only thing that I can add is, from a public health perspective, cyclosporiasis has only been nationally notifiable since the late 90s. 1999, I think, is when it was made nationally notifiable. And it's reportable in, I think at last count, 43 states. So a quick side note on public health surveillance. So if a disease is reportable in a state, that means that it's mandatory for physicians and laboratories to report that case to the state public health department, who will then follow up and interview the case and collect all of this epidemiological information that we need to be able to try and track down what it was that made that person sick. If a disease is nationally notifiable, then it's voluntary for the states to submit that data to CDC, where we take all of that information and sort of try to figure out nationally what's going on, and provide assistance to the states as needed. So 1999 was when I guess we sort of first started systematically tracking this disease. So
okay,
a relative newcomer, I guess.
Relative newcomer. It's just a baby in the pathogen world. Okay. there's two questions I'd like to ask, and then these might be our last two. One of them is it known what the original host for Cyclospora may be? It sounds like humans are required. Is that the knowledge, that humans are the required host? Okay. How about other animals? Any?
So, I mean, as far as, the literature will inform us, this particular Cyclospora is, specific to humans. There's some other indication that there may be some possibility that other primates, might be able to. But basically, I think just consider it, act on it as if it is human specific. It is certainly known that it can be acquired and pass through, wildlife. There are publications again, but I will just mention one caveat. It's one of our challenges in thinking about sources, doing, root cause assessments or analysis, and again, I would welcome Dr. Straley to add on, or Jennifer, is that many of the early tests, many of the techniques, because of the challenges and the difficulty, we have a hard time having a high degree of confidence in some of the studies that are published when they've associated detection of Cyclospora in different environmental sources, in wildlife and water systems. So that is fortunately changing, but we have to be very careful about extrapolating what we read from past literature. But it can be in soil, certainly it can be in water, and it can passage through wildlife and domesticated animals at some level.
Okay, thank you, Trevor. Okay, this will be our last question. I'll make it a two-part question so I can combine two things. One person asked about contaminated produce, possibly cross-contamination with non-contaminated product. Is that occurring? Also, did this become more prevalent when vegetables there was more bagging and sealing of vegetables versus, but based on what you said, Trevor, if this is showing up in herbs like cilantro, basil, and such, those generally are not always packaged. So, two-part question.
Well, I lost
cross-contamination.
Cross-contamination, of course,
yeah.
And again, I think, fairly, without having the details, without the knowledge currently of what the outbreak investigation, is finding, I think that concern is part of why you see, out of an abundance of caution, this expanding recall of a variety of products, and knowing that even with the current practices around water treatment and cleaning and sanitation, that there would be concern that if a particular product processing line was contaminated, it might be very difficult to ensure that all of that has been removed with the normal measures that are taken. And one of the others I just want to point out, since it came up in one of the questions we didn't get to, but if you recall, one of the slides that Jennifer went through said there is building evidence, very good evidence, that there are domestic sources, within the United States. It's not just imported produce that's involved. I think there's, good evidence for that, and good evidence that at some level in locations that is in the environment, it is in water sources, whether that's through inadequately processed wastewater treatment or sewage spills, whatever it may be, but it's around. And so we really are driving the message home that it's not just about imported produce. Jennifer, anything to add to that?
No, I would absolutely agree, and I think we need to realize that there's a lot that we don't understand, and I think it would not serve us well to make assumptions, to make any assumptions about this organism.
Thank you. Well, hopefully there will be money put into research, and we can continue to learn about this. I did want to say one thing before we close up questions, and that is that a takeaway with regard to what to tell consumers right now about not just this outbreak, but Cyclospora in products, is that that should not be consumed, that it cannot be washed, you know, that washing of the product will not remove it. Would that be fair to say, Jen and Trevor, that people should really follow the recall notices, and that particularly vulnerable people should not consume the product if it's known to have been a part of a recall?
And I think that's the advice, Shelley, for any recall.
Anything. Yeah.
Yeah.
Let me just very quickly just add, if you're interested, please take advantage of visiting the Center for Produce Safety website. There you can see the projects that have been funded that are specifically addressing Cyclospora, and there are several of them looking both at trying to accumulate information on prevalence, but also reassessing, reevaluating some of the different interventions or inactivation techniques that might be practical for the industry.
Great, thank you. Yes. So again, as Jen said, and recalls, we should always pay attention to recalls. Please follow the federal government's recall notices, and they'll always indicate what you might tell consumers. As we move into the summer, and this is regards to fresh produce across the board that's not part of any recall, there are some very important things people can do at home. They can, rinse produce. They can always handle produce with clean hands. They can keep meat, poultry, seafood, eggs separate from produce that's going to be eaten raw, say in a salad. You can make sure that particularly cut produce is chilled, is kept refrigerated. Throw away produce that is heavily damaged or perhaps past its expired, in that it is beginning to be rotted produce. Do not eat it. So Produce Pro is a source for you all about things like produce, including that frozen produce should be handled per the instructions on the package. That's another important thing to share with consumers. Before we go, I did want to tell you about something we're doing this summer that we're very excited about. And it is in the interest of really raising visibility of safe recipes. A safe recipe is a basic recipe that has been edited to include simple food safety prompts. We're having a contest. Backfighters, folks in public health, anyone who teaches others about safe handling of food at home is invited to be part of it. We even have a category just for retailers, and we have a category for kids. So please take part in this safe recipe contest, because we are building recipes for consumers. The research powerfully shows that if a recipe includes a food safety prompt, people will do it. And hand washing for in just one observational study had more than 40% increase in hand washing just by the inclusion of a simple prompt. So please take part in the contest. Check out our website for information on that. The Partnership for Food Safety Education is supported by some of the leading food industry associations, companies, scientific organizations in the United States, and we're very proud to recognize our Tier 2 partners, Cargill, the FMI Foundation, NSF, and PMA. And please visit our website for more information about all the terrific organizations that are part of this amazing partnership. Thanks so much to Jen and Trevor. We will do a follow-up email to you, and this is a super important thing to stay on top of. I appreciate the time you took to inform the backfighters. The people who are on this call are doing amazing work keeping consumers informed, and the better they feel prepared to answer questions, the better off we all are. So thanks for taking that time.
My pleasure.
Okay, it's been a pleasure to be with you all. Thank you.
Yep.
Bye-bye. Bye, everybody.